Hey everybody, it's Hump Day, it's Wellness Wednesday. This is Dr. Michael Hyland coming to you live on Facebook for Wellness Wednesday on this 10th day of April 2019. And today we're going to be continuing our topic on self-treating your low back pain and what you can do to do that. So if you watched the video last week, we talked about 4 key points. If you have an initial onset of back pain, what you should do. Number 1, assess the situation. Am I okay, or can I move this and that and the other, or do I need to stay still? Number 2, if you feel like you can move, try specific movements to see if it feels better, or if you can identify that position that gives you relief versus more pain. Number 3 and 4, if you remember, those points were keep moving and keep moving, one with an exclamation point. So provided you can find that comfort zone of movement, one of the best ways to move your low back, to mobilize the spine in a way that isn't going to necessarily cause more pain or injury, could actually be relieving, is pelvic tilting. Now, that's not necessarily the easiest skill in the world, especially for those that are a little bit less motor driven. But I'm going to show you 2 ways to do that in case it's a little more difficult to do the first version. The most common way I teach it is lying down. You can also do it on all 4s, and we're going to do both of those positions. Alright, so pelvic tilting 101. We're going to lie on our back with our knees bent. So if you were already on the floor, this might be good, but you can lay in your bed, on the floor, on the couch, wherever you have enough room. And with this one, I like to teach people to put their hands on the front of the hips here, so you can kind of feel what's going on a little bit in more than one place. So for pelvic tilting, we're going to do posterior pelvic tilting first. You're going to be rolling, kind of flattening your low back and rolling those hips towards your face, okay? So we're going to be rolling toward our face, and then to anterior pelvic tilt, we're going to go down that way. So we're going to go that way. So we're going to arch the low back. Then we're going to flatten the low back, and then we're going to arch the low back. One of the things I recommend once you get used to this movement pattern is try to bring your abdomen a little bit, try to tuck that in by pulling your belly button a little bit towards your backbone. And you kind of get a little bit of a solid core that way. You get that. So you can try this movement and work it in a pain-free range. Do 10, 15, 20, 30, whatever feels better. Start out with 10 or 15 at first and work your way up, and just kind of, that's a pretty quick, easy way to move your back in a safe way. The second way is to do it on all 4s position, or quadruped position. So in yoga, this is called cat and cow, or I guess CatCow is the most common name for it. So we're doing the same motion with this, but in a different way. So remember, when I was on my back, we did posterior pelvic tilting first, and that's by flattening the low back. Now if you're in all 4s position, you're going to arch your back. So that's the cat, and then our anterior pelvic tilt, that's your cow. So posterior, anterior. So regardless of the anatomical direction you're moving, you can remember cat-cow. Arch the back and let the back sag. Arch the back and let it sag. And you might find that the range of motion is more or less than I'm doing. That's okay. Excuse me, pardon my frog in my throat. Those are 2 safe ways to move your back, at least initially, when you're not sure what you can do to move it. And just that alone could be really helpful to relieve initial onset of pain, because you're in positions that are, when you're lying on your back like I was earlier with your knees bent, you have all that compression taken off of the spine. So it's a good decompressing position, and you can move that lumbar area of your back by moving the pelvis without stress on the back, as well as the other position. You're not weight bearing when you're on all fours. At least you're not weight bearing through the spine. You're horizontal to gravity, so you can work the range of motion in a gravity-free environment, and you're not weight bearing. And give those things a try. And even if you don't have currently, bad back pain right now or acute pain, if you have chronic back pain and whatsoever, this is helpful as well. A word of caution: if you have spinal stenosis, that sagging position, or where you have more of a hollow in your low back, could increase pain. But if you bias your motion towards that arch the back kind of a position, whether you're lying down or in all fours, that could continue to be a range of motion you can work. The tendency with spinal stenosis in particular is people don't move enough. And if that's the case, those joints are going to become even more impaired. And typically with spinal stenosis, the joints in the spine itself are affected, and that's what gives you that narrowing where the nerves exit the back. So we're going to talk more about that later, and we'll do some more self-help techniques next week. Hope you enjoyed this. Please share this video, especially with somebody you know that could benefit from this to treat their back pain. And I will catch you next week for Wellness Wednesday. Have a great rest of your day, and as always, be empowered.